Heart disease remains the #1 cause of death in the United States, and as people age, their risk of heart attacks, strokes, and other cardiovascular complications increases dramatically. Many seniors believe that prescription medications, regular checkups, and avoiding unhealthy foods are enough to keep their hearts healthy. But what if the real problem isn't just genetics or lifestyle choices? What if a simple vitamin deficiency is making them vulnerable to heart disease? People in the United States, the United Kingdom, Canada, and Australia often rely heavily on blood pressure medications, cholesterol-lowering drugs, and even invasive procedures like stents and bypass surgery to keep their hearts functioning. But what if some of these issues could be prevented or even reversed just by making sure the body is getting the right nutrients? Most doctors focus on treating heart disease after it happens rather than helping people prevent it in the first place. Yet, the heart needs certain vitamins to function properly, to regulate blood pressure, to prevent dangerous clots, and to keep arteries clear. Without these essential nutrients, the heart is constantly working under stress, and over time, that can lead to life-threatening consequences. The sad reality is that many seniors are suffering from hidden deficiencies that increase their risk of heart attacks and strokes without even realizing it. The good news is that adding the right vitamins to a daily routine could make a significant difference in heart health, but most people have no idea where to start. One of the most overlooked yet critical vitamins for heart health is vitamin D. Studies have repeatedly shown that a deficiency in vitamin D is directly linked to an increased risk of high blood pressure, hardened arteries, heart attacks, and even sudden cardiac death. Despite how common this vitamin is, most seniors simply do not get enough of it, especially those living in colder climates like Canada and the United Kingdom, where sun exposure is minimal for large portions of the year. Even in the United States and Australia, where sunlight is more abundant, seniors still struggle with low vitamin D levels because the body's ability to produce it from sunlight decreases with age. The skin simply isn't as efficient at synthesizing vitamin D, meaning older adults can spend time in the sun but still remain deficient. On top of that, many seniors spend less time outdoors, whether due to mobility issues, concerns about skin cancer, or simply not feeling the need to go outside as often. This means their vitamin D levels drop even further, leaving them vulnerable to serious cardiovascular problems. The role of vitamin D in heart health is much bigger than most people realize. This vitamin helps regulate calcium levels in the blood, and when there isn't enough of it, calcium can end up in the arteries rather than in the bones where it belongs. This leads to calcification, a dangerous condition where arteries become stiff and clogged with calcium deposits, making it harder for blood to flow properly. Over time, this significantly increases the risk of heart disease, high blood pressure, and fatal heart attacks. Many seniors are shocked when they discover that their arteries are hardening, yet they've been taking calcium supplements for years. But the real issue isn't calcium itself, it's that their body's done to have enough vitamin D to properly manage it. Seniors who take calcium supplements without enough vitamin D may actually be increasing their risk of heart disease rather than improving their bone health. This is why vitamin D is so crucial for not only preventing osteoporosis, but also maintaining flexible, healthy arteries. Despite its importance, vitamin D deficiency is widespread, and many doctors fail to check their patients' levels regularly. Even seniors who believe they are getting enough vitamin D from their diet are often mistaken. While foods like fatty fish, egg yolks, and fortified dairy products do contain some vitamin D, the amounts are far too low to reach optimal levels, especially for older adults. The recommended daily intake of vitamin D in many countries is still far too low, with some guidelines suggesting just 600 to 800 IU per day. But research shows that this is nowhere near enough for most people, especially seniors. Studies suggest that optimal vitamin D levels require at least 2,000 IU daily, and in some cases, individuals with severe deficiencies may need even more. Seniors who suffer from chronic inflammation, frequent infections, depression, or persistent fatigue should have their vitamin D levels checked as soon as possible because low levels could be putting their heart at significant risk. It's not just about heart disease either. Vitamin D also plays a role in reducing inflammation, which is a silent killer when it comes to cardiovascular health. Many seniors experience chronic inflammation without even realizing it, and this ongoing inflammation can contribute to the buildup of plaques in the arteries, leading to dangerous blockages. Vitamin D has powerful anti-inflammatory properties, helping to reduce the levels of inflammatory markers in the blood that are linked to heart disease. People who are deficient in vitamin D often have higher levels of C-reactive protein, CRP, a marker that indicates systemic inflammation. High CRP levels have been found in individuals with heart disease, making it clear that inflammation is a major contributor to cardiovascular problems. By ensuring the body has enough vitamin D, seniors can help keep inflammation levels under control and protect their arteries from damage. Despite all of this, vitamin D is still one of the most neglected vitamins in the medical field when it comes to heart disease prevention. Many doctors overlook it entirely, or only check levels after a patient has already experienced a heart attack or other complications. Yet research continues to show that maintaining proper vitamin D levels is one of the easiest and most effective ways to support heart health. Seniors who take vitamin D supplements regularly, especially in the fall and winter months when sun exposure is limited, may significantly reduce their risk of heart disease. But it's important to note that not all supplements are created equal. Vitamin D3, cholecalciferol, is the most effective form, as it is the type that the body naturally produces when exposed to sunlight. Some seniors may also need to take vitamin K2 alongside vitamin D to ensure that calcium is directed to the bones rather than accumulating in the arteries. Many studies suggest that vitamin D and vitamin K2 work together to keep arteries clear and prevent dangerous blockages. For seniors who want to protect their hearts, checking vitamin D levels should be a top priority. Many people don't realize they are deficient until they experience serious symptoms like muscle weakness, fatigue, joint pain, or even chest discomfort, all of which can be early warning signs of an underlying cardiovascular problem. Taking control of heart health starts with the basics, and ensuring the body has enough vitamin D is one of the simplest yet most powerful ways to reduce the risk of heart disease. Seniors who take proactive steps to maintain healthy vitamin D levels may be able to avoid unnecessary medications, hospitalizations, and life-threatening cardiac events. Yet, millions of people in the United States, the United Kingdom, Canada, and Australia remain dangerously low in this essential vitamin without even knowing it. The question is, how many more heart attacks and strokes will it take before people start paying attention? Another critical vitamin that plays a major role in heart health, yet is often overlooked, is vitamin K2. Most people have heard of vitamin K. Vitamin K2 is essential for activating a protein called matrix glay protein, MGP, which prevents calcium from depositing in the arteries. Without enough K2, this protein remains inactive, allowing calcium to build up in the blood vessels over time. Studies have shown that people with higher intakes of vitamin K2 have a significantly lower risk of arterial calcification and heart disease. In one study, individuals who consumed the most K2 had a 52% lower risk of developing severe atherosclerosis, which is the hardening and narrowing of the arteries that leads to strokes and heart attacks. Another study found that every 10 micrograms of vitamin K2 consumed per day reduced the risk of heart disease by 9%. Yet, despite this incredible research, vitamin K2 remains one of the most ignored nutrients in modern medicine. Many cardiologists fail to even mention it to their patients, leaving countless seniors vulnerable to calcium buildup, arterial damage, and fatal heart attacks. The reason vitamin K2 is so rare in modern diets is that it is mostly found in foods that people no longer eat regularly. The best sources of K2 include grass-fed animal products, fermented foods like natto, a Japanese dish made from fermented soybeans, certain cheeses, and organ meats. However, the modern Western diet has almost completely eliminated these foods. Seniors who are already experiencing high blood pressure, poor circulation, or signs of heart disease should consider checking their vitamin K2 intake immediately. The consequences of low K2 levels can be devastating. In one study, postmenopausal women with low vitamin K2 levels had significantly higher rates of arterial calcification, making them far more likely to suffer from heart disease. Another shocking study found that people with the highest levels of arterial calcium deposits were nearly 4 times more likely to die from a heart attack compared to those with lower calcium buildup. This means that a deficiency in vitamin K2 could literally be the difference between life and death for many seniors. Many experts now recommend combining vitamin K2 with vitamin D3 because the two work together to keep calcium out of the arteries and direct it to the bones where it belongs. Taking vitamin D alone without K2 can sometimes lead to calcium buildup in the wrong places, which is why seniors should never rely on vitamin D alone for bone and heart health. The best forms of vitamin K2 for heart health are MK4 and MK7, with MK7 being the more bioavailable form that stays in the bloodstream longer. Many studies suggest that taking at least 100 to 200 micrograms of vitamin K2 per day can significantly reduce arterial calcification, lower heart disease risk, and support overall cardiovascular health. Yet, many seniors are not getting anywhere near this amount, and their heart health is paying the price. Another major issue is that many seniors in the United States and Canada take blood-thinning medications like warfarin, which directly interfere with vitamin K2. Warfarin prevents blood clotting by blocking vitamin K1, but it also prevents vitamin K2 from doing its job, leading to a much higher risk of arterial calcification over time. This is why people who take long-term blood thinners often develop severe heart problems later in life. The irony is that while these drugs are meant to prevent strokes, they can also increase the risk of heart attacks by allowing calcium to build up in the arteries. Seniors who are on blood thinners should speak to their doctor about monitoring their vitamin K2 levels and potentially adjusting their diet or supplements to ensure their heart stays protected. Many people don't realize that heart disease isn't just about cholesterol levels. It's about inflammation, calcium buildup, and arterial stiffness. Vitamin K2 is one of the most powerful nutrients for keeping arteries flexible and preventing deadly blockages, yet it is one of the most ignored vitamins in mainstream medicine. Seniors who want to protect their heart should seriously consider increasing their intake of vitamin K2, whether through diet or supplementation. The question is, how many people will continue to suffer from heart attacks before doctors start paying attention to this life-saving nutrient? Another essential but often ignored vitamin for heart health is vitamin B12, a nutrient that plays a critical role in keeping the cardiovascular system functioning properly. Most people associate vitamin B12 with energy and brain health, but what many don't realize is that a B12 deficiency can drastically increase the risk of heart disease, strokes, and blood clots. This is because vitamin B12 is essential for reducing homocysteine, an amino acid in the blood that, when elevated, can cause severe damage to the arteries, increase inflammation, and lead to dangerous blood vessel blockages. Many seniors in the United States, the United Kingdom, Canada, and Australia unknowingly have high homocysteine levels, making them more vulnerable to heart attacks. Yet most doctors rarely test for it. One of the biggest problems is that vitamin B12 deficiency is extremely common in older adults, and the symptoms can be subtle or mistaken for aging. Fatigue, memory loss, dizziness, shortness of breath, muscle weakness, and even depression can all be signs of a severe B12 deficiency, yet most seniors have no idea. By the time a doctor identifies the problem, significant damage may already be done. Studies have shown that people with high homocysteine levels are at a much greater risk of developing heart disease, and many cardiologists are now recognizing that treating vitamin B12 deficiency could be a key to preventing strokes and heart attacks. Vitamin B12 plays a direct role in keeping blood vessels clear and reducing dangerous clot formation. Yet millions of seniors are unknowingly deficient. The problem is that as people age, their stomach produces less intrinsic factor, a protein necessary for absorbing B12. This means that even if someone is eating foods rich in B12, such as beef, eggs, or dairy, they may not be absorbing it properly. To make matters worse, many seniors take medications like proton pump inhibitors, PPIs, for acid reflux or metformin for diabetes, which further reduce B12 absorption. This means that even those who eat a healthy diet may still be deficient, putting their heart at serious risk. In one alarming study, researchers found that individuals with the lowest B12 levels had significantly higher rates of arterial stiffness, a condition that leads to high blood pressure, poor circulation, and increased risk of heart attacks. Another study showed that people with high homocysteine levels were twice as likely to suffer a stroke or heart attack compared to those with lower levels. This is why experts now recommend that seniors, especially those at risk for heart disease, check both their B12 levels and homocysteine levels regularly. Yet, despite this clear connection, most routine blood tests do not include homocysteine screening, leaving many seniors completely unaware of their risk. The best way to correct a vitamin B12 deficiency is through supplementation, but not all forms of B12 are equally effective. Many people take cyanocobalamin, which is the most common form found in cheap supplements, but the body must convert it into methylcobalamin, the active form of B12 that is best for heart health. Methylcobalamin is more bioavailable and stays in the body longer, making it the best choice for reducing homocysteine and protecting the arteries from dangerous plaque buildup. For seniors who struggle with absorption issues, B12 injections or sublingual, under the tongue, B12 supplements may be necessary to ensure they are getting enough of this vital nutrient. Research suggests that taking 1,000 to 5,000 mcg of methylcobalamin daily may help lower homocysteine levels and significantly reduce heart disease risk. One of the most shocking realities is that many heart attacks could potentially be prevented just by ensuring the body has enough vitamin B12. Yet, doctors rarely discuss this simple solution with their patients. Instead, they prescribe statins, blood pressure medications, and blood thinners, all while ignoring a major underlying cause of cardiovascular disease, high homocysteine levels. Seniors who have already suffered a heart attack or stroke should immediately have their B12 and homocysteine levels checked, as correcting a deficiency could be one of the easiest and most effective ways to prevent another cardiac event. Many people assume that heart disease is all about cholesterol, but the truth is that nutritional deficiencies can be just as dangerous, if not more so. Without enough vitamin B12, the body cannot regulate homocysteine properly, leading to inflammation, artery damage, and an increased risk of deadly blood clots. Seniors who experience symptoms such as unexplained fatigue, tingling in the hands and feet, dizziness, or memory problems should not ignore these warning signs, as they could indicate a severe B12 deficiency that is silently damaging the cardiovascular system. The real question is, how many more seniors will suffer heart attacks before the medical community finally starts recognizing the life-saving role of vitamin B12 in heart health? Another crucial, yet often ignored vitamin for preventing heart disease is vitamin C. Most people associate vitamin C with boosting the immune system, but what many don't realize is that vitamin C is absolutely essential for maintaining strong, flexible arteries and preventing dangerous plaque buildup.